Nighttime leg cramps, often called Charlie horses, can be incredibly painful, violently disrupting your sleep and leaving your muscles sore for days. For adults over 60, these sudden muscle spasms are especially common, but they don't have to be a permanent fixture in your nights. Section 1. Emergency leg cramp solutions. What to do right now. When a calf cramp strikes at 3 a.m., you need immediate relief. The goal is to interrupt the neurological signal causing the muscle to relentlessly contract. The weight-bearing stretch. Immediately get out of bed and stand on the affected leg. The act of putting your body weight on the leg forces the calf muscle to stretch and sends a signal to your nervous system to release the contraction. The seated towel pull. If you cannot stand, sit up in bed with your legs extended. Loop a towel, bedsheet, or belt around the ball of your foot. Keeping your knees straight, gently pull the towel toward you, flexing your toes toward your head. The wall push. Stand a few feet facing a wall. Lean forward, placing your hands on the wall, keeping the affected leg straight behind you with the heel firmly planted on the floor. You should feel a deep stretch in your calf. The pinch technique. Acupressure. Pinch your upper lip firmly between your thumb and index finger. Some neurological studies suggest that stimulating this bundle of nerves can distract the central nervous system and short-circuit the cramp reflex. Jiggle and shake. Once the peak pain subsides, gently shake the leg to encourage blood flow and relax the residual tension. Section 2. Why nighttime leg cramps happen, especially over 60. Understanding the root cause is critical for senior health. As we age, our bodies undergo changes that make us more susceptible to nocturnal leg cramps, NLC. Physiological changes, tendon shortening. As we age, the tendons connect our muscles to our bones naturally shorten and lose elasticity. This makes the muscles more prone to seizing up when resting. Motor neuron loss. The nerves that send signals to your muscles can misfire more often as you get older, leading to spontaneous contractions. Deceased circulation. Aging can reduce blood flow to the extremities, depriving muscles of oxygen and necessary nutrients during sleep. Common triggers dehydration. A lack of fluids is a primary cause of muscle spasms. Seniors often have a decreased sense of thirst, making hidden dehydration a major culprit. Electrolyte imbalances. Low levels of magnesium, potassium, calcium, or sodium disrupt the electrical signals that tell your muscles to contract and relax. Medication. Side effects. Many common prescriptions for those over 60 cause cramps. Statins, cholesterol medications, diuretics, water pills for blood pressure, and asthma medications are notorious for this. Prolonged sitting. A sedentary lifestyle allows the calf muscles to remain in a shortened position for too long, setting the stage for nighttime spasms. Section 3. Natural cramp remedies. If you prefer to avoid adding more medications to your routine, several natural and home remedies have proven highly effective for muscle spasm relief. The shock remedies for immediate relief. Pickle juice. Drinking 1 to 2 ounces of pickle juice is a scientifically backed remedy used by professional athletes. It works not because of the sodium, but because the acetic acid, vinegar, triggers a reflex in the back of the throat that tells the nervous system to stop the muscle spasm. Yellow mustard. Swallowing a teaspoon of yellow mustard works on the exact same neurological principle as pickle juice. The turmeric and vinegar stimulate nerve sensors in the mouth and throat. Topical and physical therapies, magnesium. Oil spray. Applying transdermal magnesium spray directly to the calves before bed can help relax the localized muscle tissue. Heat. Therapy. A heating pad or a warm towel applied to a cramped muscle increases blood flow and helps it relax. A warm bath with Epsom salts, which contains magnesium before bed, is a great preventative measure. Cold therapy. If the muscle is sore after the cramp has passed, massaging the area with an ice cup, water frozen in a paper cup peeled back, reduces inflammation. Deep tissue massage. Use your thumbs or a massage gun to apply firm, kneading pressure to the center of the cramp. Always stroke upward toward the heart to encourage venous return. Section 4. Sleep health and long-term prevention. To stop cramps from ruining your sleep health, you must adopt a preventive daily routine. Pre-bedtime stretching routine perform. These stretches for 3 minutes every night before getting into bed. Calf drops. Stand on the edge of a step. Hold onto a rail. Let your heels drop below the level of the step until you feel a stretch. Hold for 30 seconds. Hamstring stretches. Tight hamstrings pull on the calves. Sit on the floor, reach for your toes, and hold. Sleep positioning. How you sleep dictates the resting length of your muscles. If you sleep on your back, do not use heavy, tucked-in blankets that force your toes to point downward. Plantar flexion. This shortens the calf muscle. Keep the blankets loose or prop your feet up with a pillow so your toes point up. If you sleep on your stomach, hang your feet off the edge of the mattress so your ankles are in a neutral position. Hydration and diet protocol. The water rule. Drink half your body weight in ounces of water daily. If you weigh 160 lebbies, aim for 80 oz of water. Stop drinking large amounts an hour before bed to avoid nighttime urination trips. Electrolyte-rich foods. Incorporate bananas, sweet potatoes, and avocados, potassium, spinach, pumpkin seeds, and almonds, magnesium, and dairy or fortified plant. Milks, calcium. Consider a magnesium supplement. Talk to your doctor about taking magnesium glycinate, highly absorbable, gentle on the stomach, an hour before bed. It promotes muscle relaxation and better sleep. Daytime activity. Keep the muscles engaged during the day. If you cannot walk long distances, riding a stationary bike for 15 minutes a day is excellent for keeping calf muscles elongated and flushing out lactic acid. Section 5. Over 60 health. When to see a doctor. While most nighttime leg cramps are harmless, they can sometimes mask more serious medical conditions. Do not ignore cramps if they are accompanied by any of the following red flags. Deep vein thrombosis, DVT. If a cramp does not go away and the leg becomes swollen, red, and hot to the touch, this could be a blood clot. Seek emergency medical care immediately. Peripheral artery disease, PAD. If your legs cramp predictably when you walk a certain distance and the pain goes away when you rest, claudication, this is a sign of narrowed arteries. Neuropathy. If the cramps are accompanied by numbness, tingling, or a pins and needles sensation, you may experience nerve damage, often linked to diabetes or spinal stenosis. Frequent disruption. If the cramps happen multiple times a week and are severely impacting your quality of life, your doctor needs to review your medication list to see if a prescription needs adjusting. A note on quinine. In the past, doctors frequently prescribed quinine for leg cramps. The FDA has strongly warned against this practice, as the risks of severe side effects, including blood disorders and heart arrhythmias, far outweighs the benefits for leg cramps. Do not use over-the-counter tonic water in large amounts for this purpose without consulting a physician.